Okay, this will be my physical assessment area. Okay. Nothing there. Nothing there across. And then nothing on the table. Okay. Just put this here. Let me make sure I got it. Okay. Knock knock. Hi, I'm Will. I will be your nurse today. Hand hygiene, patient privacy, closed occurrence. Hi, can I get your name and date of birth, please? Okay, go ahead and check. Okay, Mr. Bear, you are. Can you tell me what brings you in today? Physical assessment. All right, let me get that started for you. Go ahead and sit over here. Can I ask you what day of the week it is? Okay, do you know where we are at? And can you please tell me who the current president of the United States is? Perfect. Patient has a LOC ×4. All right, Mr. Bear, I'm gonna go ahead and ask you a series of questions. Have you had any pain lately? No? No pain at all? That's good. How about mentally? Have you been happy or sad lately? You've been happy? And has this been ongoing? Yes? Okay, you've been happy. Are you allergic to anything, any allergies? To any medications, food, latex, iodine, or even the environment? No allergies? All right, perfect. When was your last bowel movement, Mr. Bear? Mr. Bear was able to tell me his last bowel movement was this morning. Can you please describe it? It was no diarrhea, no discoloration. It was brown, firm, no pain while having a bowel movement. No pain at all. And then was there any blood or was there any mucus when you had your bowel movement? No blood at all. How about urination, Mr. Bear? When was the last time you had urination? This morning. Can you please tell me about it? Describe it for me. Mr. Bear stated his urination was clear, no odor, no bleeding, no discoloration in Mr. Bear's urination, and stated that there was no pain at all during urination. Okay, Mr. Bear, I'm gonna go ahead and take your vital signs first. Make sure hand hygiene. Mr. Bear's temperature is a 98.7, pulse 71, respirations 20. And while Mr. Bear was sitting with the legs, making sure the legs are not crossed, and on his preferred arm, the right arm, I took Mr. Bear's blood pressure. It was 110/80. Okay, Mr. Bear, I'm gonna go ahead and start the physical assessment on you. And what I'm gonna first do is I'm gonna do your olfactory nerve, and I'm gonna see how well your vision is. So I'm gonna go ahead and stand 20 feet away from you. I'm gonna have you cover one eye, and I want you to read the Snellen chart, the Snellen test. This is called the Snellen chart, and I want you to read the letters from top to bottom, left to right, to the best of your capabilities. And I'm gonna do the same. We're gonna do the same thing with your other eye, or your other eye is covered as well. Mr. Bear was able to read perfectly all the way to the 20th line, so Mr. Bear's vision is a 20/20 vision. Thank you, Mr. Bear. Now, Mr. Bear, I'm going to go ahead and assess your face, your skin. Just letting you know, this physical assessment will involve me touching you. Is that okay? Perfect. So, hand hygiene, wear gloves. I'm going to go ahead and assess your face to see if there's any bruising, discoloration, cuts, or abnormalities around the face. Was able to assess the scalp too. There is no dandruff or scales or redness in Mr. Bear's scalp. Okay, Mr. Bear, I'm going to go ahead and look through your ears. Since you are an adult, I will go ahead and pull up. Pull up. Mr. Bear's ears were great and are in great condition. Minimal cerumen. It is pink, and Mr. Bear's ears had no signs of trauma, bleeding, or abnormalities in Mr. Bear's ears. All right, Mr. Bear, I'm going to also assess now your eyes. So what I'm going to do is I'm going to put my pen light to your eye. I'm going to do it again. The reason for that, I'm going to do the first one was for direct constriction. Now the second time was for consensual constriction. And I'm going to do it again for the next eye as well. Okay, Mr. Bear, now I'm going to go ahead and do accommodation. Now, Mr. Bear, if you could please follow my pen light. Please do not move your head, and I'm going to test you for accommodation. Okay. and I did it, and I'm gonna do it with the light on as well. Mr. Bear's eyes or pupils were round and reacting to light as well. Now, Mr. Bear, I'm gonna also do the 6 fields cranial test on you. And what I'm gonna have you do, I'm gonna stand around 12 to 18 inches away from Mr. Bear, and then I'm gonna have you again follow my pen light, just your eyes and not your face. And I'm gonna go up, down, diagonal, 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 diagonal. All right, great, Mr. Bear. Mr. Bear was able to pass the test. His cranial 3, 4, and 6 were all checked and ready to go. Now, Mr. Bear, I'm gonna also check your nose. Can you please tilt your head up? Okay, Mr. Bear's nose was all good. It was moist, no dryness in Mr. Bear's nose, and there was no bleeding or discoloration discharge in Mr. Bear's nose. I'm gonna also test you on your cranial nerve 1 for your smelling, Mr. Bear. So I'm gonna go ahead for cranial 1, get 2 scents, and I'm gonna have Mr. Bear cover one nose, and I'm gonna have you try to identify the 2 scents. And I'm gonna have you do the same thing with the other side of the nose as well, and switch off. Mr. Bear was able to smell both scents, identify both scents, so now Mr. Bear was able to pass cranial nerve 1, which is great. Now, Mr. Bear, I'm gonna have you open your mouth, and what I'm gonna be doing is assessing his lips, his mouth, gums, teeth, tongue, tonsils. Everything looks good. The frenulum is midline, which is great, and I was able to assess his tonsils. It's grade 1. Everything looks good inside Mr. Bear's mouth, which is great. Now, Mr. Bear, I'm gonna also now assess you for lymph nodes, okay? And what I'm gonna be doing is me touching you around your neck and below. Is it okay if I touch you? Yes? Okay. Close and hygiene. We'll go ahead and go pre-auricle, post-auricle, perfect. Occipital, no pain, Mr. Bear, no. And this is the base of the skull. And then I'm gonna go repharyngeum, submandibular, and submental. Okay, everything looks good there, Mr. Bear. Now I'm gonna go ahead and go down the posterior chain of your back, back of your lymph nodes, and I'm gonna go to supra-anterior clavicle area. Okay, everything there seems good, Mr. Bear, while I assessed your lymph nodes. Now I'm gonna go ahead and assess for jugular vein distension. So, Mr. Bear, I'm gonna make sure you have to be in a 45-degree angle, and then I'm gonna have you turn left. And I'm gonna assess for jugular vein distension. And I'm gonna have you look right and assess for jugular vein distension. He has to be in 45-degree angle. Mr. Bear showed negative signs of jugular vein distension, so everything was good there. Now, Mr. Bear, I'm gonna go ahead and assess your arms. Here, I'm gonna be palpating for your temperature first, warm to see if they're the same temperature. And I'm gonna be palpating over the bony prominences as well to see if there's any edema. As of right now, Mr. Bear, you have no edema around your bony prominences. Everything looks good. Can you push and pull? Cool. Can you move your arms around? Range of motion? Good. All right, Mr. Bear, I'm gonna also just assess your arms just to see if there's any discoloration, bruising, or any abnormalities again in your arms. No? Okay, can I go ahead? I'm gonna go ahead and see your nails. I'm gonna check for capillary refill. Press down for 5 seconds, let go, and I could see that blood return was less than 3 seconds, so Mr. Bear was able to have great blood flow back to his finger, so he passed capillary refill. Now, Mr. Bear, I'm gonna go ahead and check your skin tugger test, which is below the clavicle, and what I'm gonna do is I'm gonna pinch, and it was elastic, no signs of tenting. It didn't stay as a tent, so Mr. Bear was hydrated. Now, Mr. Bear, I'm gonna go ahead and do reflex test on you with my reflex hammer. And at first, I'm gonna go ahead and do the brachial area. So not brachial, the biceps. So during the biceps, I'm gonna put my thumb on the cubital area, and with the pointy side, I'm gonna hit my thumb, and I should see flexion. Mr. Bear was able to show flexion, so he passed for the biceps. Now I'm gonna do triceps, and Mr. Bear, can you hold your arm up while I'm holding him, helping him, support him? And I'm gonna do the pointy side as well, and I'm gonna hit above the elbow. And Mr. Bear was able to show extension for here, so he passed there. Now for the brachial radialis for the wrist, I'm gonna have you, Mr. Bear, I'm gonna go on the flat side this time, 2 to 3 inches above the wrist. and I'm looking for sumination at all, and hit, and I was able to assess for sumination. Mr. Bear, can you also show me some flexion and extension with your arms and test and see if there's any pain there? Mr. Bear was able to do that. Mr. Bear was able to show reflexes in arms, so it was a grade level 2 in his arms. Now, Mr. Bear, when it comes to your knees, did you have any injuries or surgeries? No? Okay, so I'm going to test your reflexes on your knees, your legs and knees as well. Alright, so I'm going to go below the knee as well. Go below the knee as well. Mr. Bear was able to show reflex, so Mr. Bear on his legs as well, grade level 2 on his legs. Now, Mr. Bear, I'm going to go ahead and listen to your carotid artery and and also your heart sounds. I'm going to be listening first with the carotid artery with the bell of the stethoscope. What I'll be doing is listening for any beats around your in your carotid arteries. All right. So with the bell of the stethoscope, I'm going to go ahead and listen. And if you could hold your breath and then exhale for me, please. Exhale. There you go. There you go. And then now I'm going to also go ahead and palpate the carotid artery as well. And this is going to be between the trachea and subcleido muscle. So I'm going to go right here. Not muscle, the neck. So I was able to assess it. Okay, everything looks good there. Now I'm going to go ahead and auscultate for your heart sounds. So now I'm going to first go in the second intercostal space on your right side, and this is with the diaphragm of the stethoscope. So right intercostal space, which is the aortic. Second intercostal space on the left side, which is your pulmonic. Go down for your third intercostal space, which is your herbs. Go down a little more in the middle, which is your fourth intercostal space, which is your tricuspid. And then I'm going to go down a little more, but to the left, for your mitral, which is between the fifth and sixth intercostal space, which is also your apical pulse. So I'm going to be doing here, so I'm going to listen here for a whole minute. And I was able to assess that, auscultate that Mr. Bear had 70 heartbeats per minute. Okay, Mr. Bear, I'm going to go ahead and listen to your lung sounds as well. With the stethoscope, can you please inhale and exhale as I put my stethoscope on you? And it's going to be 6 times too. 1, 2, thank you, 3, 4, 5, 6. Thank you, Mr. Bear. And I was just able to auscultate in the lungs and compare the lungs and listen to them. Everything sounded well. I'm going to also listen to the fourth and sixth intercostal space, the middle lobe. So I'm going to have you raise your right arm. I'm going to listen here. Okay, everything sounds good there. Now, Mr. Bear, I'm going to also have you turn around and lean a little forward. I'm going to assess your lungs in the back, and I'm going to go 8 points. And again, when I put my stethoscope on there, if you could inhale and exhale deeply for me. Thank you. So I'm going to inhale, exhale. Perfect. Inhale, exhale. 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 And I'm going to make sure I avoid the scapula while I do this. Now I'm going to assess for your elevated breathing, your breathing pattern. So I'm going to go to the T10 level of your back. And I'm going to have you breathe. Okay, perfect, Mr. Bear. I was able to assess that Mr. Bear had no unlabored breathing. His breathing was normal, so everything was fine with Mr. Bear's lungs with the front and the back. All right, Mr. Bear, I'm going to go ahead and assess your abdominal area. So if you can, please lie down for me. Thank you. So what I'm doing here is I'm assessing if Mr. Bear's umbilicus is in the middle, seeing if there's any abnormalities or discoloration with Mr. Bear's stomach or abdominal area. So I'm inspecting first, got to see if there's any bruising, cuts. Like I said, everything looks good on Mr. Bear's abdominal area. Now I'm going to go ahead and auscultate Mr. Bear's abdominal area. And I'm going to have to go in a certain sequence. So first I have to go in the right lower quadrant, then right upper quadrant, left upper quadrant, and left lower quadrant. And here it goes. Listening, listening, auscultating, auscultating, and then auscultating. I was able to listen. I'm supposed to listen around 15 seconds. I heard around 16 to 30 gurgles for Mr. Bear's abdominal area. Now, Mr. Bear, I'm going to listen for any bruits in the abdominal area as well, but this time, like I did before, this is with the bell of the stethoscope. I'm going to go below the umbilicus and I'm going to go 4 times. 1, 2, 3, 4. Perfect, Mr. Bear. I heard no bruits. I did hear timpani, so everything was sounding normal for Mr. Bear. Now I'm going to go ahead and percuss and palpate Mr. Bear's abdominal area in the same sequence I auscultated. So I'm going to percuss in the right lower, right upper, left lower. Perfect. Now I'm going to go ahead and palpate. Perfect. Mr. Bear was able to tell me there's no pain or tenderness during this abdominal assessment. Now, Mr. Bear, I'm going to go ahead and have you stand up. I'm going to go ahead and assess your feet. See if they're, go ahead, do the same thing, bony prominences, if there's any edema, palpate for any temperature differences. Temperature was warm in Mr. Bear's feet. Able to assess Mr. Bear's feet if there's any cuts, bruises, anything abnormal around Mr. Bear's feet. Everything seemed fine. Mr. Bear, I'm going to do the same thing I did with your arms. With your hands, I'm going to do capillary refill time. Capillary refill, press valve in 5 seconds, let go, return 3 seconds. Now I'm going to do range of motions like how you're able to do with your arms. You're able to move your arms. I'm going to have you go knees to chest. Perfect. I'm going to have you also wiggle your ankles. Perfect. Now I'm going to also have you go ankles to shin. Alright, so everything looks good. Your leg, lower extremities, there was no edema, just like your arms, no edema, everything was in unison. Alright, now Mr. Bear, I'm going to go ahead and test your more of your cranial nerves. I'm going to go into your cranial nerve 5, your trigeminal nerve. I'm going to have you close your eyes. I'm going to get a sharp and dull object. And what I'm going to do is I'm going to lightly touch the top of his head, the top of the scalp, and then the chin to see if Mr. Bear could feel it. Okay? No? Yes, you could feel it. You could feel it. Mr. Bear was able to feel both with his eyes closed. So Mr. Bear was able to pass cranial nerve 5. Now, Mr. Bear, I'm going to have you test for cranial nerve 7, which is smiling, which is your mouth. Can you smile, frown, puff your cheeks, and smile your teeth? Perfect. Mr. Bear was able to pass cranial nerve 7. Now, Mr. Bear, can you, now I'm going to test Mr. Bear's cranial nerve 8. I'm going to stand behind him 1 to 2 feet apart. And then I'm going to have him cover his ear, and I'm going to whisper a phrase. And I'm going to do it to the other ear as well while he covers it. And Mr. Bear was able to repeat the phrase back to me. Now, Mr. Bear, I'm going to go ahead, and he passed cranial nerve 8. Now, for cranial nerve 9, 10, and 12, I'm going to have Mr. Bear open his mouth, stick his tongue out, go up, down, left to right. Mr. Bear was able to move his tongue perfectly. Can you swallow for me? No, he told me there's no painful... he has no difficulty swallowing. So Mr. Bear was able to pass cranial nerve 9, 10, and 12. Now, Mr. Bear, for the last cranial nerve, I'm going to test for 11. Can you move your shoulders? Perfect. Can you shrug? Perfect. Trying to assess your strength. Mr. Bear was able to pass cranial nerve 11. Now, I'm going to go ahead and do a reflex accommodation test. See if you can follow my movements. Mr. Bear was able to follow my movements. Thank you, Mr. Bear. Now, Mr. Bear, I'm going to have you stand up and walk 5 feet away from me, and then walk back to me toe to heel so I could assess for balance. Mr. Bear was able to do that properly. All right, now, Mr. Bear, I'm going to do the last test, which is the Romberg's test. Is while you stand up, I want you to close your eyes, feet together, and put your arms on the side. And I'm going to put my arms in front of you and behind you, and I'm going to assess if you have any unbalance. Mr. Bear was able to balance, had some good balance, and was no signs of swinging or uncoordination. All right, so there you go, Mr. Bear. Thank you for letting me do your physical examination. All right.